Hi, I'm Dr. Johnny. Thanks for joining me today, talking the neck, and we're talking 4 ways to treat your neck without having surgery. How to tighten the neck area so that you can avoid or at least delay surgery, because a lot of people, they're scared of it. They're afraid of an unusual pull that it's going to create. A lot of people still with aesthetics, yes, they're scared that their friends are going to know. Heaven forbid that they might get surgery. You can get your teeth done, not a problem. Get your hair done, it's okay. You can even get lashes or extensions. But if you had a bit of Botox, not good. You know, you might be ostracized from your friend group. So, what are some things you do that no one will know that you had anything done, gives you that tightening of the neck, and restore a bit of collagen? Because a lot of times people are losing collagen, they get sag, there's muscle, it's complex. You go to your clinic, heaven forbid, you don't know what to do. There's so many treatment options, and in the United States you can advertise these, so there's a lot of marketing to skew people. Understand too that a lot of devices cost clinics $100,000, $250,000 for a device is not that much anymore. That's about standard, 200 grand. Clinics have to make that back. So I'm going to give you 4 options for tightening your neck without surgery. If you want to avoid and delay it, stay tuned to this video. We'll also show you some footage. Okay, so the neck area, of course, we know we have skin, which can lose collagen, get thin and crepey. Then there's muscle, which the platysma muscle, it's tough. You can slow it down with Botox and different things, but the muscle gets a bit saggy. When the skin is saggy, the muscle loses some of its contour and strength and you get a little waddle. There's fat. Some people might have more fat than others, and that plays a role. Bone loss along the jaw plays a big role, especially females, estrogen loss. We know the whole story. A lot of people don't want surgery for the aforementioned reasons. So what do we do? What are the options? What's cost effective? Let's start with my number 4. Home care. A lot of people like to do things at home. Retinoic acid. You can use retinols. In my product, I have retinol acetate. I like that a lot. If you're using a retinol that you like, good. A retinoic acid, and for my patients, I give them a 0.1%, and it has hyaluronic acid, a few other things in it. It's a great product, but I use that on the neck. You hear people tell people not to use it under the eyes and the neck. For my patients, I follow them along. It's cost effective. It's not an expensive product. Helps to build collagen, thicken the skin, add glow. The tighter your skin here, the less you're going to see fat and sag. So topical, that's great. I'm not talking a lot about home devices here, but galvanics. A lot of people talk about NuFace, other galvanics, micro rollers or dermal rollers. I'm a fan of them if used properly and you know what you're using, and I'll put that in along the skincare route. But an easy one is your retinoic acid prescription strength. If you're not using that or you can't tolerate it, retinol acetate. Okay, number 3. If you look along the jawline, what you're going to see is the sagging skin for a lot of people, especially if they're thin, they're not carrying weight, and the skin type 1 to 3 seem to work best. So if you're lighter colored skin, think about high frequency ultrasound. People know it as Ulthera. Those who watch and subscribe to the channel, you know I like radio frequency that I can tune to different depths. If I can go and not go deep and maintain fat where I want it, because we want fat here because it's making the skin fuller and it won't look as crepey. We do not want fat here. If you get rid of too much fat with these heating devices, you will maybe see a platysma band. Most people would rather see that band than have fat. 6 of one, half dozen other, depends, personal decision. The nice thing about heating is it can tighten the look of that band a little bit by tightening the skin. So not to confuse the situation, but heating, high frequency ultrasound, radio frequency, so Ulthera, radio frequency would be, I like the Viora device. Thermage is one that people know, been around long time. As long as I've been in this aesthetic medicine world, I remember Thermage in the early 2000s, so at least the prototypes. So heating the skin, that would be my number 3. We go to number 2, and I like fillers. Specific, 2, 3 are my favorite. So if you take along the jawline, the highest G prime for most bang for the buck, happy patient, at least for the first few months, is some calcium hydroxyl apatite or Radius. It's a cost-effective product. It's a collagen stimulator. It adds a nice sharp chiseled jawline. Restylane Define, another great one, doesn't draw a lot of water in. Again, has higher G prime than what the numbers show. You really need to use a 22 gauge thick cannula to get through there. Parallel lines of beauty, watch my video on that. The jawline and the cheek are parallel and gives a beautiful look. So that would be fillers. And of course, I have a video, if it's not posted already, it's coming. It's on using high dose Sculptor along the jawline. Really like that procedure because the first dose of Sculptor is your skin tightener. The second and third, fourth, beyond is your volumizer, so you can add volume, but you're not gonna get that high G prime crisp border. Now we're at number 1. So what's the number 1 quickest, most effective way to tighten the jawline? And as a bonus, you're going to stimulate collagen at the same time. It's a PDO thread, a barbed, or now we're using molded PDO threads. And it helps with that band because we're pulling back. And we can cross them in this fashion. 4, 1, 2, 3, 4. And people tolerate it well. The PDO polydioxanone will build the collagen. The barbs pull back. And it's minimally painful, and you can put in, you can use a little local anesthetic. There's not a lot of anesthetic. A little lidocaine with epi at the openings, all I use. You can attach it with the Nova threads. You can attach the lidocaine to the cannula, drip it in as you go along. People hardly feel it. It's quick and easy. You can add it on to a neuromodulator or botox dysport appointment, and you're in and out the door. So in terms of longevity, something like that is going to last. It depends. When you like it, you might want to repeat it 2 to 4 months, not a problem. But typically when you get where you want to be, the results are going to last you a year to 2. Now, all of those things can, guess what? Be done together, because that's what I would do, all of them together. There's nothing wrong with that. They work synergistically. Watch my videos on heating, melt fillers. Watch my different ones on the jawline, parallel lines of beauty. They're all there. Go to the playlist on the neck. If you like these videos, click like, subscribe, join me here to keep your skin and body beautiful, healthy, and vibrant.